I'm here with Dr. Bruce McLucas, who is the founder of the Fibroid Treatment Collective here in Beverly Hills. And we're here today to talk about a number of things. There's been a lot of news recently about something called a power morcellator and how that can affect people who are being treated for fibroids and uterine tumors. I mean, there's a lot of confusion between fibroid tumors and cancerous uterine tumors. A lot of women are confused and a lot of women are dealing with these issues. And I know, Dr. McLucas, you have answers about a lot of them.
The fibroids are benign. I mean, they cause some terrible symptoms, but fibroids are benign growths. They are not cancerous, and this is, they are the cause of, I'd say, 500,000 hysterectomies, removing the uterus, and myomectomies, leaving the uterus and cutting out the fibroids every year. So that's 500,000 surgeries being done for fibroids, and they're almost always benign. Now, in 1/10 of 1% of women, there is a confusion. When you start thinking you're going to be dealing with that benign tumor, and it turns out that it's a sarcoma, it's a cancer. The problem, Pat, is that we have no specific test that can tell us before we start to do a surgery, and we'll get to this later in the interview. But there's no specific X-ray, there's no ultrasound, there's no pelvic MRI, there's no CT scan that can say this is a cancer, this is a benign tumor. And that was part of the problem with the morcellator.
So exactly what is a power morcellator?
As the name implies, Pat, it's an instrument that uses power to out of a very small incision, take big bits of tissue, and it does it by having a spinning blade that will cut up the tissue.
So it cuts it into morsels.
Yeah, it morcellates it, yeah, exactly. It makes morsels out of it. But in that rare case where that tumor that you thought was benign is a cancer, the worry is that the morcellator might spread the disease and give you less of a survival rate afterwards.
So once you find out that you do have fibroids, then comes the question of what to do about it and what some of your treatment choices are. And I know there are a number of them. I know that you've been really involved in fibroid embolization.
Well, compared to the worry of the morcellator, and we'll talk a little bit more about the morcellator soon, fibroid embolization does not cut up any tissue. It basically starves the fibroids by blocking the blood supply.
So do they shrink up and
they shrink. One of my patients said very well, it's like going from a grape to a raisin. And compared to myomectomies where you take out the fibroids after embolization never come back. So if you're a young woman, 25, and you've got fibroids, you have a myomectomy, it's not a good bet to say that that's going to be your only fibroid surgery. They will come back.
That happened with my sister. I mean, she had to have 2 procedures done.
Yeah.
And with a number of women that I've known that, you know, you don't deal with it once, this could return.
Yeah. But after embolization, there's no recurrence.
And the morcellator is not used in embolization.
Fibroid embolization, no scalpels, no stitches, no morcellator for sure. We don't cut up the uterus. We basically starve the fibroids, and it causes them to shrink. And I tell all of my patients, you'll feel like you did maybe 5 years ago. That'll be enough to stop your symptoms.
Oh, that's very good news. And no morcellators involved, so we don't have to deal with that either with fibroid embolization.
No scalpels, no sutures, no morcellators. Yeah.
Well, we'll continue this discussion. Thank you so much for watching.